Brain tumors are a relatively rare disease, yet they require treatment from the entire breadth of medical care. So it's very important to build a team that works well together, that collaborates both inside and outside our institution. I find many patients think it's reassuring to know if they're going to have an all-day surgery that there won't be one surgeon who's working the whole time, but that we'll be alternating and taking turns so that you're always getting the best effort. We work in our operating rooms on communication. We're been pioneers at our institution in using the team steps process to make sure that every member of the team, not just the surgeons, but every person in that room is contributing to their maximum. So the skull-based tumor is particularly complex because its location is in prime real estate. And so these tumors sit between the brain and the sinuses and the ears, and there's no area in there that's without important structures. So the expertise in the ear or in the sinus may come from an ENT surgeon, the expertise in the brain cavity from a neurosurgeon, and by partnering and working together, we ensure that the patient gets the best possible outcome. These are very difficult cases to do, and they would be even more difficult without true partnerships between different surgeons. In planning for surgery, we start with the first visit that we have with the patient, and we think all the way through the patient making the fullest recovery. We don't just think about the surgery and the techniques that will be used in the operating room. So for example, if a patient has a tumor that may rob them of the only hearing in their good ear, we may implant a brainstem implant at the time of that surgery that we won't use for many years, knowing that someday we'll activate it and that will become their window to hearing. The good news is that a vast majority of patients will make a very full and rich recovery. Without a doubt, the sooner we get the patient involved in rehabilitation, the quicker they'll be back on their feet. So that starts in our neuroscience intensive care unit. The doctors who are there are specially trained to treat ICU patients who have neurologic disease. The patients then quickly transfer to a neuroscience floor where they begin physical therapy, speech therapy, occupational therapy, and evaluation by rehabilitation physicians. In neurosurgery, being able to visualize ahead of time and during the surgery the exact anatomy of the brain, where all the important structures are, where are the safe ways to get there, where are the dangerous structures is very, very important. During surgery, we use image guidance where we have the equivalent of GPS in someone's car we have in the operating room to guide our way through the brain. And we use that along with advanced preoperative imaging, intraoperative monitoring and localization to pinpoint the safest way to get to a tumor. The first is the Brain Tumor Treatment Consortia, which is a large group of like-minded institutions around the country, almost 20. Our primary mission in that is to rapidly test new treatments in a collaborative fashion and determine whether they have promise. The second group we belong to is called the CERN, or the Collaborative Ependymoma Research Network. Ependymoma is a classic example of a brain tumor. Not very common, but when it occurs, good treatment can make the difference between cure and not curing. And this network is a group of like-minded people who are interested in defining the best treatment strategies and pooling our data together to find the best way to treat each patient. And the third group that we belong to, which is actually being formed now, is called the Alliance, and this is formed through the NCI and the NIH, and will be a large brain tumor consortia led out of the Mayo Clinic that will define best treatment strategies going forward. We try to partner with the referring physician and the primary care physician to deliver as much care for the patient close to home as we can, while still having access to the cutting-edge treatments that a large university can bring them. I meet patients and their families at very important moments in their life, and many times these things happen very suddenly. And I know that if I'm able to assemble a team that can care for that patient, and that team is smart, has the best technology, has the best understanding of the disease, and communicates well with the patient and the family, that we can make a dramatic difference in their lives. We can help them through a very difficult time and hopefully get them back to a full recovery. And when that goes well and it works, it's the most satisfying experience in the world.